Hello everyone, welcome back to our channel. If you are preparing for the OET speaking test, you are probably wondering, what if I get a really difficult case? What if the patient is resistant or anxious? How do I make my responses sound natural and professional? Don't worry, I have got you covered. Today, we will go beyond the basics and explore big real life connections that will help you tackle any OET speaking scenario with confidence. Are you ready? Let's see our first example. Imagine this, you are a nurse in a cardiology clinic. A 47-year-old male patient has just been diagnosed with high blood pressure and is feeling extremely anxious. And he tells you like this: I don't understand why this is happening. I eat well and I feel fine. Do I really need medications? When you hear this type of question, how do you respond? Let's break it down step by step. First, you need to acknowledge the emotion by saying that I completely understand how you feel. Okay, because receiving a new diagnosis can be overwhelming, especially when someone feels very healthy. Right, and try to explain the condition in very simple terms. High blood pressure often doesn't cause noticeable symptoms, which is why it's sometimes called the silent killer. Even if you feel fine, it can put extra strain on your heart and increase the risk of complications like heart disease or stroke. And try to give assurance and offer solutions. The good news is that high blood pressure can be managed effectively with lifestyle changes and necessary medications. We will work together to find the best plan for you and finally check their understanding. Would you like me to go over any part again? So, these are the ways that you need to follow when you're responding to a question or when you're responding to a patient. Okay? And patients often resist treatment because they don't fully understand their condition, right? And your role is to educate them without making them feel scared or pressured. Let's see another example here. This example is about explaining a procedure to a worried parent. Now, imagine you are a pediatric nurse. A mother brings in her 3-year-old son who needs a minor surgery under anesthesia. She looks very worried and asks, is anesthesia safe for children? I'm really scared about this. So, for this mother, how do you need to respond? First, try to acknowledge the concern by saying, I completely understand your concern. It's very natural for any parents to feel this way. And try to provide a clear explanation with facts. Anesthesia for the children is very safe when monitored carefully. Okay, and you have to give them assurance that your anesthetist carefully calculate the exact dosage based on their child's weight, age, and medical history. Okay, and try to use an analogy. Say, for example, like a chef measuring ingredients, we ensure the perfect dosage and always invite further questions. I want you to feel completely confident about this. Do you have any other concerns that I can address? So, by dealing this way, that you're acknowledging their concern and also you're reassuring them by giving proper explanation and providing them facts, and you can invite further questions too whenever it is required. Okay, so when dealing with parents, confidence and reassurance are key. Using analogies makes medical concepts easier to understand and reduces their fear. Let's see one more example. Here, you are breaking bad news gently, okay? And you are a home care nurse visiting an elderly patient who has diabetes. Unfortunately, his condition has worsened, and the doctor has recommended amputation of a toe to prevent further infection. The patient is upset and says, amputation? No, I don't want to lose a part of my body. There must be another way. So, in this case, how do you respond? First, you need to acknowledge their fear, okay? By saying, I understand that this is really difficult news to hear. Anyone in your position would feel the same way. And gently explain why it's necessary. You can tell like the infection in your toe is very severe, and if you don't act now, it could spread to the rest of your foot or even your leg. So, our goal is to stop the infection before it gets worse and try to offer a positive perspective. Many patients who go through this adjustment recover well and continue to live independently. So, our team will support you through every step of the healing process. And finally, encourage the patient to express their feelings. Do not stop them to express. I know this is not easy. How are you feeling about this decision? So, here, breaking bad news requires compassion, honesty, and reassurance. So, always offer a hopeful outlook while ensuring the patient understand the medical necessity. Got it? Now, let's move on to another example, dealing with a non compliant patient. You are a nurse at a general practice clinic. A 60-year-old man with diabetes has not been taking his medication and is very frustrated with his diet plan. And he says, I hate all these diet restrictions. I don't see the point. I just want to eat normally. Now, how do you respond to him? First, empathize it. I hear you. It's tough making these changes, especially when food is such a big part of our daily lives. And try to explain the long term impact by saying uncontrolled blood sugars leads to serious complications. Okay, and that is the reason we encourage a specific diet. Tell the impact and try to offer flexibility. Let's balance your favorite foods with healthier choices. So, here you're offering flexibility and motivate with a goal. Small changes now will help you stay active forever, right? So, here you are motivating them with a goal. Patient resist change when they feel restricted, right? That's a very natural thing. So, you have to try to provide solutions, not strict rules. Remember that. Instead of forcing rules, help them to find solutions that fits their lifestyle. And here comes the final thoughts when it comes to mastering the OET speaking test with confidence. So practice real life role plays with variety of patient types. Use simple language and analogies for clarity, okay, to explain very complex medical concepts so that the patients can understand easily. And try to show empathy and reassurance in every scenario. Encourage patient participation by asking open ended questions. Stay calm and confident. Your tone matters as much as your words. So try to apply these strategies. You'll be fully prepared to handle any OET speaking scenario with professionalism and ease. I hope you liked this video. Kindly like, share, and subscribe for more OET tips. See you in the next video. Bye for now.